As many as 2 million Americans will be infected by antibiotic-resistant bacteria this year, and more than 20,000 of them will die as a result. But while doctors are urged to be cautious when to use antibiotics, Doug Johnson shows they can play an important role in your child's health.
For Jakirie Haymore, today's visit to River City Pediatrics is a well-child visit. But the 12-year-old knows that the season can bring more serious illnesses, leaving her too sick to do much of anything till it passes.
It's honestly like can't really do much, really just sit in the room all day and watch my brother play around because I don't want to get him sick. And I just sit in my room, eating soup, watching TV.
Jakirie's pediatrician, Dr. Seema Abbasi, says there are certain times when a child's problems call for the use of antibiotics to relieve their symptoms.
Antibiotics work for any bacterial infection, and in pediatric patients, most of them are either ear infection, strep throat, sinus infection, and occasionally bladder infection.
Parents should keep an eye on sick kids. Duration and severity of an illness can be a good indication of the type of bacterial infections that may be helped by antibiotics.
If somebody has a sore throat, and that has lasted for 2 or 3 days, then there's a possibility it could be a strep throat. And so that's a reason to come to a doctor's office and get checked for that and be treated with an antibiotic.
But every time doctors use antibiotics, there's a risk of developing antibiotic resistance, which means the next time the medications might not work as well. Because of that, doctors try to be careful when recommending antibiotics, especially for viral problems. Those drugs don't help. There are some problems, a cold for example, that antibiotics don't help at all. That's something a child might have to suffer through with the help of an anti-inflammatory to help with the aches, pains, and fever. That could be bacterial sinusitis, which can have cold-like symptoms, running 10 days or more without getting better. Children can have thick yellow nasal discharge and fever over several days. They can also suffer from headaches behind or around the eyes. The doctor may prescribe an antibiotic to treat the infection. Kids may also need acetaminophen or ibuprofen for the headaches and saline nose drops for the nasal congestion. Parents shouldn't automatically ask for antibiotics when their child is sick. The pediatrician can do a better job of figuring out what type of a problem the child is dealing with by tracking their symptoms first. For Smart Medicine, I'm Doug Johnson.